Advancing Cancer Recovery. My name is Anorexia. And today I want to talk about a topic that is close to my heart, that impacts many, many patients, but is rarely discussed. And that topic is cancer anorexia. And I really hope you can stay until the end of this broadcast. It's only a few minutes away, because if you're struggling with loss of appetite, or if you know someone in treatment who is suffering with this infliction, then you can understand and appreciate how difficult and painful this can be. And you can understand how important it is to offer them some solutions. So this is what we're going to talk about, cancer anorexia. I hope you can stay until the end, because I'm going to kind of offer a new service that I'm excited about, that I haven't offered before in this particular way. It's going to be to a very limited amount of people for a very limited amount of time. So I really hope you can stay tuned. It is exciting. But before we dive in, if we haven't met before, my name is Anorexia. I'm the author of this little book right there, The New Cancer Paradigm. And I'm a cancer recovery specialist, an alternative medicine practitioner, helping patients to bolster immune function, increase resilience, and significantly enhance their body's ability to defend against and recover from cancer. If you want to learn more about that or my work, you can certainly do that on my website, avinoamlelno.com. You can watch my TEDx talk there on that topic, or you can tune into my YouTube channel, and there's many other outlets. So feel free to do that. But let's dive in, because the topic of cancer anorexia is really a very painful one. There's a tremendous amount of suffering involved. So the first point that I want to make is that cancer anorexia is very different from the eating disorder that we're kind of familiar with, which is called anorexia nervosa, which is where the person is depriving themselves of food, starving themselves. And cancer anorexia is very different, mainly because there's no conscious decision to deprive oneself of eating. There's simply no appetite. And this is the main difference. It's important. There's all kind of other difference, but I feel this is the one that makes most sense. So I want to address that. The next point that I want to make is that there are some medical solutions to this challenge. Some of them work better than others, but it's really imperative for patients and their family members to be well informed and to truly understand what treatment options are available to them. Having said that, there is also non-medical solutions to this challenge, and the one that I'm going to address today, in particularly, which is related to my work, is designed to awaken the person's appetite, to strengthen their will to live and their desire to heal. And the solution that I'm working with is hypnotherapy, which is very different from the kind of hypnotherapy you watched at your high school graduation ceremony or any kind of entertainment show. Couldn't be further from that, because hypnotherapy, in a nutshell, is a very safe and practical therapy that works best when it is an adjunct support to the medical treatment at play. It's not so much an alternative. It really works best when it's part of the whole treatment strategy. So I hope you can hear my message on that. And hypnotherapy, in a nutshell, is a state, or hypnosis is a state of focused attention and heightened suggestibility, which means we use words, suggestions, to address some of the possible contributors to this lack of appetite. Some of them can be anything from fear and anxiety, helplessness, hopelessness, lack of self-worth, and many others that may kind of lurk in the background. And it's really important to address those, because, again, we're not talking about a conscious decision to stop eating. We're talking about simply lack of appetite. Food is no longer a priority. And part of the suffering that many patients that I've worked with have talked about is the fact that people begin to treat them like kids. And I know I have two girls, and I kind of chase around, I chase them around with food, trying to feed them. But the point is, when we are in treatment and our body is struggling with treatment side effects and just the burden of treatment, it is altogether different. And part of the struggle or the suffering for these patients is the fact that they kind of being reduced to being a child again. So I just want to put it out there because it's another aspect that caregivers may not necessarily be aware of. Just keep it in the back of your mind. But hypnotherapy is really an effective approach here because, again, we're not talking about a conscious process. We're talking about a process that is happening beneath the surface on a subconscious level. And which brings me really to the core of these broadcasts, the message that I want you to understand, which is that my priority as a practitioner is to help my patients, my clients, to transcend the limited physical dimension of appetite, which means they can begin to consider the act of eating, irrespective of their desire to eat, as an act or as part of their decision to live. As part of their decision to live, which is really the very bottom line of it, changing my client's perception, if you will, of food and eating from a mere act, physical act, if you will, to an act that is inspired by their desire to live another day, week, year, or many years. That's the very core of it. The whole point is to help them change their perception of food and eating so that this is now becoming a part of their decision. This act is now part of their decision to live well and maintain that quality of life. If you yourself are struggling with loss of appetite, or if you know someone, again, as I've said before, who's in treatment and suffering in this way, you understand how difficult and painful this experience can be, not only for this person, first and foremost, but also to everyone around, because there is this sense of helplessness that is embedded in the fact that I would love to eat. I can't really get any food into my body. And that's, of course, is critical so that we can maintain a state of health, so that our body can maintain its resilience and its ability to sustain treatment. Because we know that when we complete treatment regimen, we increase our odds for recovery. And so this is the critical point. If you want to learn more about that, do feel free to reach out to me either through this Facebook page. Many of you will watch these broadcasts as a replay. So do know that I come back often to these threads, and I answer any question and answer any comment that you may leave for me. And this is important. My goal is to offer some support and be of resource to many of you out there, because it can be a lonely journey. And so please know that I'm in your corner and I'm happy to support. Which brings me to the close of this broadcast, because I wanted to, where is it? Where are the time? Okay, well, never mind. I wanted it to be a short kind of broadcast and just kind of throw it out there, that there are many things that can be done to support you or your loved ones. And I'm more than happy to elaborate on that as we go along. To close, I really want to point out several things. First of all, I want to address this little promise that I made at the beginning. If you did stay through the end and you are interested to learn more, I'm offering for a very limited amount of time and only to 2 people. So you can certainly be one of these 2 people. A new form of a discovery session, which is basically 45 minutes that we're going to spend together digging into your experience or your loved one's experience and crafting an action plan that is viable, that is practical, that can be implemented to get you or your loved ones back into health in the best way possible. So I'm happy to offer that. It's only for this week. So if you want to take advantage of that, if you want to reserve your spot, simply write in the comments below the word learn. And I will be more than happy to reply to you with an invitation for that special discovery session. If it works, I might do more of those, but for the time being, there's just 2 spots. So the rest, if you want to take advantage of that, there's going to be an associated cost to that. Having said that, I also want to kind of point out that beyond of these individual broadcasts, I'm starting a whole new broadcast series called So Over Cancer with a co-host named Shannon Knight. She's a wonderful woman, a two-time breast cancer survivor, and I'm so looking forward to just digging into everything about cancer with her, because her perspective is really precious. And I believe that combining my knowledge and skills and her personal experience and skills can be of great benefit to you. This will usually be on these Mondays, and I believe it'll be 3 p.m. Eastern Time, 12 Pacific. So these individual broadcasts that I'm making right here and right now, we will find another day to do that. But all of it will be kind of displayed, and you will be informed if you choose to like this page, and you get all the notifications. In the meantime, thank you for your time. I look forward to supporting you and answer any question you may like. Leave a comment. I come back to this thread oftentimes. Thank you. It was a pleasure. Take care.